because you're right in front of me. I've been dispatched to the scene of what?
Of a 30-year-old woman, rollover crash. She's 20 feet from the car.
Okay, so MVA rollover with MVC rollover with ejection. All right. So I arrive on scene. First of all, scene safety BSI for myself and my partner. I'm going to do a general impression or overview of the scene. I see the patient lying 20 feet from the car. Any visual injuries or bleeding as I approach?
Head trauma, bleeding from the left side of her head.
Okay. Significant bleeding or just mild?
Mild.
Okay.
Yeah.
No pooling?
No.
Okay. All right. And as I approach her, is she conscious? Is she looking around?
Unconscious.
Okay. Police and fire in the area?
Fire's on scene.
Fire's on scene. All right. I will call police for traffic control if necessary. I will also call ALS because patient is unresponsive and it's probably a significant trauma with ejection. What is the weather like and the temperature outside?
Cloudy and cool, 40 degrees.
Okay. And how long has she been outside? Do we know how long before the accident's been? A long extended period
It's
of time?
30 minutes.
30 minutes, okay. All right, so I'm going to arrive on scene, scene safety VSI. Again, I want my partner to take manual, inline, neutral stabilization of the head. And I'm going to check for level of consciousness. Ma'am, can you hear me? Does she respond?
No response.
Okay. I'm going to elicit a painful response by pinching the ear. Does she respond?
No response.
Okay. So at this point, I'm going to do a modified jaw thrust. Open the airway, look, listen, and feel. Is she breathing?
She's breathing.
What rate is she breathing at?
Shallow, 10 breaths a minute.
10 breaths a minute and shallow. Okay, so at this point, I'm going to have my partner ventilate this patient with a non-rebreather, 12 to 16 breaths per minute, high flow 15 liters. And I'm also going to measure and insert an opiate to protect her airway.
She accepts.
She accepts it. Now I'm going to fillet the clothes and expose the chest. Do I see any life-threatening? Is my partner able to bagel without difficulty?
Yes.
Okay. I'm looking at the chest. Do I see any life-threatening injuries?
No.
Okay. So I'm going to begin to palpate, start at the top, work my way down and around and reach underneath. Do I find anything when I do that?
Nope.
As I do it on the patient's left side, do I find anything?
They do like a flail segment?
You can do that if you want.
Yeah.
Okay, so I feel crepitus, I notice a flail segment, my partner is ventilating this patient, so that will act as an internal splint. Okay. Next thing I'm going to do is listening to lung sounds. What am I getting for lung sounds?
Left lung, you hear stridor.
Okay, well, okay.
Or,
yeah, you can say that diminished.
diminished. Yeah.
Wheezing diminished, okay. All right, that would make sense. Okay. So the next thing we're going to do is due to my patient's mechanism of injury, I do want to check the back for life-threatening injuries that would affect breathing. To do that, we have to log roller, so the first thing I'm going to have to do is apply a collar. So what I'm going to do is palpate for tracheal deviation. I'm going to inspect for JVD. Do I see any?
No.
I'm going to feel the back of the neck for step-offs or crepitus. Do I feel any?
No.
I'm going to measure and apply a collar. Is the collar on?
Collar.
Now we're going to log roll a patient. Person in the head does the count. We're going to have as many people interlock arms. Put this arm up. We're going to log roll him over at his count. 1, 2, 3. As the patient is up, I'm going to run my fingers down the spine. Is the spine stable?
Yep.
I'm going to inspect. Do I see any life-threatening injuries? Any kind of injuries to the thorax?
You don't see any. Nope.
I'm going to listen to lung sounds. And I'll just go, 6 places. What am I getting?
Still diminished.
Still diminished. Okay. And I log roll her on this side because the injury is on this side. So I logged her to the unaffected side. And palpating, I don't palpate anything as well, correct? Okay. I'm also going to check the back of the head and the back all the way down for any bleeding or anything, any drainage, anything like that.
Slight bleeding in the leg.
In the leg, which leg?
Left leg.
Left leg. And do I see any open fractures, anything like that?
Nope.
Or was it laceration?
Just the last one.
All right. So now we're going to log roll the patient back over onto a backboard with the person at the head doing the count. 1, 2, 3. The person is now down onto the backboard. I'm going to check for a radial and carotid pulse. What am I getting? 123?
Yeah, 123.
Okay, 123. The skin is what? As I check the skin?
Pale, cool.
Pale and cool, clammy, all right. And patient's still unresponsive?
Correct.
Okay. So at this point, I'm going to make, and I don't see any major significant bleeds. A little bit of bleeding from the leg, a little bit of bleeding from the head.
Yep.
All right, so at this point, I'm gonna make my transport decision. It is a high priority transport. And we're gonna get moving as soon as possible, hopefully back up to the LS. Now I'm gonna start my secondary survey, using DCAT BTLS. Deformities, contusions, abrasions, punctures, perforations, burns, tenderness, lacerations, and swelling. I'm gonna start at the head. I'm gonna palpate the head, Mr. Examiner. Do I find anything?
Nothing, just
No,
that.
and there was that but it's a laceration, but the skull is stable, correct?
Yes. Yep.
Okay, and it is only bleeding slightly, correct?
Slightly, yeah.
Okay, next I'm gonna take a pen light and check the eyes for pupillary response. What am I getting?
Equal reactive to light.
All right, and the bleeding is on the right side, right?
Yep.
Okay, so I have pearl. I'm gonna check inside each one of the ears. Do I see bleeding or drainage from the ears?
You do not.
Okay, I'm gonna check in the nose and in the mouth. I know my partner's ventilating, but the nose and the mouth is clear and he's able to ventilate without difficulty. Is good compliance with the bag?
Yes.
Okay, and he's still ventilating at 12 to 16 breaths per minute.
Yep.
Okay. Next thing I'm gonna do is through the collar, I'm gonna palpate for tracheal deviation. I'm gonna inspect for JVD. Any noted?
Nothing.
Okay. I'm gonna inspect, palpate, and auscultate the chest. Do I see anything?
Just the same.
The same
left.
flail segment, yeah. I'm gonna work my way down and around. Do I feel anything that I missed?
Nope.
Do the same thing on this side, work my way around. Do I find anything that I missed?
You do not.
Okay. Next thing I'm gonna do is listen to lung sounds again. I know my partner is ventilating. What am I getting for lung sounds?
Diminished on the left side.
Still, but no changes beyond that.
No changes.
Next, I want to palpate the 4 quadrants of the abdomen. I'm going to push in and do rebound tenderness. I'm checking for distension, rigidity, and rebound tenderness. Anything found?
Some rigidity.
Where?
In the left lower quadrant.
Left lower quadrant? Okay. Noted, and move on. I'm going to check the stability of the pelvis, pushing down and in. Is the pelvis stable?
Stable.
The pelvis is stable? I almost said that. I'm going to check for bleeding, drainage, or priapism in a male, or bleeding or drainage in a female in the genitalia. Do I see any?
You do not.
I'm going to do the offhand technique and work my way down the legs, checking for a pulse. There was nothing noted on the patient's right leg, correct? It was the left leg?
Yep.
Left leg, I'm going to work my way down the left leg. I come to the laceration. Again, there's laceration and it is just lightly bleeding.
Lightly bleeding.
Okay, so I'm going to note that and move on. The leg is stable, correct?
Correct.
And I'm going to check for a pulse. I have a pulse in the extremity, right?
Yep.
It's probably weak. I'm going to check this upper extremity, do an offhand, check for a pulse.
You get one.
Unremarkable. And this side, work my way down, check for a pulse.
Good.
Unremarkable. Okay. Next thing I'm going to do is reach underneath, and I'm going to check the posterior thorax, lumbar, and buttocks region. She's on the board. I already checked it once, but I'm going to check it again. Anything noted?
Nothing.
Okay. Next thing I'd attempt to do is a sample history. Is there anybody around who can give me any kind of information?
There is no one around.
Okay. So I can look in her pockets or her wallet. We can try and find if she has any medical alert tags, anything like that noted.
Nothing.
No. Okay. Next thing I'm going to do is set up vital signs. What are we getting for blood pressure?
You're 110 over 80.
I'd probably go 90 over 50, but okay. And her pulse, you said, was 110, 120 and Freddie?
Yep.
She's breathing, we're bagging her at a rate of 12 to 16 breaths per minute, but you said she was breathing at a rate of 10 and shallow.
Yes.
Any improvement in her demand?
Slight improvement.
Slight improvement, okay. But she's still unresponsive?
Still unresponsive.
Pupillary response is still the side?
Equal.
Okay. And lung sounds have not changed, lung sounds are the same, her breathing is the same, and her skin is the same?
Yep.
Okay. So next thing I would do is treat any secondary, I would do a detailed physical exam en route as time allows. Treat any secondary injuries I found. I put a dressing on the lower extremity, the left lower extremity, and I put a dressing on the right side where the laceration is on the scalp, maybe bandage it, and then reassess my patient every 5 minutes and transport as soon as possible. Any questions?